The following presentation will go over the basics of diabetic retinopathy, presented by Molly Hosking, occupational therapy student from Spalding University. Diabetic retinopathy, often known as DR, is when vascular complications occur by abnormal insulin and blood glucose levels from the diagnosis of diabetes and can cause hemorrhaging and abnormal growth of blood vessels in the retina and sometimes in the vitreous when advanced. There are 4 types of diabetic retinopathy. Mild non-proliferative retinopathy is when microaneurysms, swelling and tiny blood vessels in the retina occur. Moderate non-proliferative retinopathy is when some blood vessels that nourish the retina are blocked. Severe non-proliferative retinopathy is when severe blood vessels that nourish the retina are blocked, causing several hemes in the eye, or known as hemorrhages in the eye. And proliferative retinopathy may develop new blood vessels that are abnormal and fragile, growing on the retina and in the vitreous gel, which can pull away from the retina that can lead to leakage. Many individuals will not notice the symptoms until the later stages. We now will be going over the anatomy of diabetic retinopathy. Vitreous gel is a gel-like substance that fills the vitreous cavity, which supports the whole eye shape with making up most of the eye's volume. The retina, found in the back of the eye, is a light-sensitive layer of the eye that helps convert light into images. Within the retina, there is a dot called the macula, and it has a small circle responsible for central vision and seeing fine detail. Diabetic retinopathy is often diagnosed by eye care professionals through a dilated eye exam or a Flesserian angiogram, which is imaging of blood vessels within the retina. According to the CDC, diabetic retinopathy is estimated between 4.1 million Americans having retinopathy and 899,000 Americans having vision-threatening retinopathy. Risk factors associated with diabetic retinopathy can include the following: of having type 1 or type 2 diabetes, increasing the risk the longer one has had the disease for, untreated abnormal blood sugar levels, high blood pressure, high blood cholesterol, being pregnant, being obese, and having kidney disease. Due to the effects of diabetic retinopathy, it can lead to other eye conditions due to its vascular effect, including diabetic macular edema, which is where blood vessels in the retina leak into the macula, causing blurry vision; neovascular glaucoma, the growth of abnormal blood vessels blocking the aqueous fluid from draining properly, which will increase the IOP, or the interocular pressure; and lastly, retinal detachment, which is scarring can occur from diabetic retinopathy, and the scars will pull your retina away from the back of your eye. Other effects of diabetic retinopathy can include floaters, scotomas, or known as blind spots, loss of color, fluctuated vision, glare sensitivity, light sensitivity, loss of peripheral vision, often from neovascular glaucoma, difficult and dim lighting or night vision, and often having the Swiss cheese effect within your vision. Medical ways to treat and manage diabetic retinopathy can include the following: of keeping up with normal range of blood sugar levels. From this, hemes or hemorrhages in the eye can go away. Injections to slow the progression of the bleeding. Laser treatments for shrinking the blood vessels and stopping leakage for saving leakage, yet can cause blind spots for more vision deficits, as well as surgery for excessive bleeding or scars within the retina. Non-medical ways for management of diabetic retinopathy can include the following: of avoiding glare with accessories like sunglasses, hats, and visors, the use of adaptive equipment that utilizes tactile and auditory senses for completing everyday tasks, learning non-visual aids and skills depending on the severity and progression of the disease with assistance from low vision rehab, enhancing contrast, adapting light, learning the visual skills of tracking, scanning, and tracing, and learning eccentric viewing techniques for increased performance when reading with the scotomas or the blind spots. Visit www.kylionsi.org/Low Vision Resources for more information regarding low vision resources that will benefit you or your loved one.